So I want to tell you a story about things that really scare me. Specifically, the hiccups. Who here has had the hiccups? Do they scare you? No? No? How long has someone had the hiccups? Interesting. So I had the hiccups one time for 22 days. Not only is it irritating, it's actually life-threatening. I had the misfortune of tearing an artery in the back of my neck and having a brainstem stroke. Landed myself in hospital in stroke intensive care, really quite broken. I didn't even notice that I had the hiccups for probably the first 4 days. But there's a problem when you're paralyzed and you have hiccups. And the big problem is, whatever the contents of your stomach are, whatever you had for lunch, is one hiccup away from coming up and going into your lungs because your chest is all paralyzed. So I was quite a mess. You know, they had me on liquid food in the hopes that I wouldn't throw that up. They tried, they put the tube up your nose and down your throat and fed me that way. But, they were just putting it in my stomach, and so the very next hiccup, up it comes. Probably after 5 or 6 days, I'd put enough of my lunch into my lungs that I started to get pneumonia. And late one night, my oxygen saturation started to crash. And I'm in intensive care, and it's a really interesting thing to go off the grid in intensive care. And going off the grid in intensive care basically means getting up, going for a walk, and pulling out all your IVs, pulling out all of the telemetry, all the monitors go off, stuff happens. The other interesting thing about going for a walk when you're paralyzed is it probably doesn't go so well. I really wasn't there. I might have been there in body, but I was not there in spirit. So they probably came in and found me crumpled at the foot of the bed, looking pretty blue. And I woke up the next morning in real intensive care. And I had this Darth Vader-esque mask on, and it was blowing what looked to be steam out the side of it and lots of oxygen, and had a very worried partner, Amanda, hovering over me, and I guess it had been pretty touch and go during the night. They were still waiting for the results to come back. With the really low oxygen levels, I had taken a shot at going into organ failure. But they propped me back up, got me on antibiotics, got me back into stroke intensive care, and their next attempt was they put a hole into my stomach and then ran a tube into there and then deeper into my intestinal tract. And that worked, that actually worked. I actually stopped with the getting pneumonia thing and putting stuff in my lungs. So that was pretty good. But, here you are 10 days in and you still have the hiccups. Here you are 20 days in, and you still have the hiccups. And if you've ever had the hiccups for a long time, it's a terrible thing. So like 20 days in, your abs are absolutely screaming, no more. And you're lying there, and you can just feel that next hiccup starting to come. And your abs just going, please, please, no. Absolutely the worst ab workout I've ever had. We were pretty desperate. It's 22 days later, and I still have the hiccups. And so my partner teaches out at the university, and she asked a colleague, really, is there nothing we can do to help Jim? And he called back in about 5 minutes, and he said, he needs to be on a drug called baclofen. If you don't believe me, Google it. he had gone the scientific route, and he'd used Medline and PubMed, and, he's a pharmacologist, but, he said, Google it, you'll get your answer. And so we Googled it, of course, and ran into this. It's an antispasmodic for MS patients, but it has this off-label use that's effective against hiccups. And so we went to the hospital, and, the doctor that was overseeing my case, he wasn't the person to talk to. He wasn't really that helpful. I remember a few days into my stroke, he swooped into the room with a long line of students in tow and presented my case and said how interesting it was. And I was, what are you going to do about my hiccups? My hiccups. And he said, well, there's really nothing we can offer you except this one drug that's called chlorpromazine, really nasty antipsychotic, and ineffective against hiccups. But it's the only one that had been tested for hiccups. So it's as far as he was going to look. So here we are, day 22, and we've come upon this drug that says that it'll work. Long weekend at the hospital, not many people around, but a very friendly doctor, and he read the literature we had printed out and was convinced that we were onto the right thing. Really lovely nurse at this point had actually already called the pharmacist and teed it all up so that as soon as the doctor said yes, they could get the pills and get them to me. Short answer is it actually worked. I was on the drug for about 4 months, eventually came off it as the paralysis started to dissipate, but you might get hiccups and they're a mild irritant. I get hiccups and it just scares me to death.